Hi, how are you going? I hope you're feeling as well as possible on your medicines. I'm Pharmacist Fi, and this is Denver. Welcome to our Medicine Safety YouTube channel, and to this episode of some need-to-know info about a medicine for gout called Colchicine, which you might know by brand names like Colgout or Lengout in Australia, or Colcrys or Mitigare or Gloperba in the U.S.A. Please note that this video does not cover everything you need to know about colchicine for gout. So if anyone ever prescribes colchicine for you, make sure you ask your doctor and your pharmacist for the latest info about exactly how to take colchicine, because this has been changing a lot in recent years. The doses are getting lower and there's a few different schedules. And make sure you also get a colchicine CMI to find out things like what to do if you get any side effects or how to store colchicine safely. A CMI is consumer medicine information, which is also called a medication guide if you live in the U.S.A. or a patient information leaflet if you live in the U.K. And this medicine information either comes with your medicine or you're welcome to ask your pharmacist to print or email you a copy of it. And I'll put a link to my video about CMIs into the description section below this video for you. Colchicine reduces gout pain by reducing the inflammation of a gout flare by changing how some immune system cells behave, which I'll explain more about in my upcoming video, Colchicine, how does that work? But because of the specific way colchicine works, it does not reduce other common types of pain. So do not take colchicine for other types of pain unless a doctor has specifically told you to do that. And also, do not give colchicine to anyone else, because some people should not take colchicine due to certain health conditions or certain medicines that they're taking. Right. Now, let's start by taking a quick look at who should not take colchicine. Then some of the things you and your doctor need to think about before your doctor prescribes colchicine. So who should not take colchicine? People with a blood problem, not making enough of one or more types of blood cells, or an allergy to colchicine or any other ingredients in its tablet or capsule or liquid. And you can read all the ingredients in the Colchicine CMI for your particular brand. And it should not be taken by people with kidney or liver problems who are also taking interacting medicines. Some precautions you and your doctor need to think about together before deciding whether you will take colchicine are: people over 65 years of age, especially those who weigh less than 50 kilos or are frail, and people who have kidney or liver problems are more likely to get side effects from colchicine. So if you're in any of these categories, your doctor will need to monitor how you are going on colchicine more often, and they may need to give you a lower dose, and in some cases they may need to even give you a longer time between your doses. And in Australia, some blood tests are usually done before starting colchicine. And these are kidney and liver function tests, full blood count, and creatine kinase. Blood tests will also need to be done during treatment with colchicine if you take it for an extended period of time. If you're on colchicine for quite a long time, ask your doctor about doing a blood test for vitamin B12 to check your level, because colchicine may reduce how much vitamin B12 we absorb from food while we're taking colchicine. Colchicine may also delay healing of wounds. So if you have any serious stomach or intestine problems, or any other wounds that you know of anywhere on your body, including your eyes, make sure you tell your doctor before you start taking colchicine so they can figure out whether it may be suitable for you or not. Another important thing you should know is that you should not drink grapefruit juice and should not eat grapefruit while you're taking colchicine, because these things interact with colchicine, which increases your risk of side effects. It's also a good idea to avoid drinking alcohol while taking colchicine, because alcohol increases the risk of side effects from colchicine. And as you probably know, alcohol also increases uric acid in our body, which increases risk of gout attacks. Like a lot of other medicines for common medical conditions, colchicine has some potentially serious side effects, which would need emergency medical attention if they ever happened. And it also has some potentially lethal medicine interactions to avoid. So please make sure you also watch part 2 of this Colchicine Some Need to Know Info series to find out about side effects, plus ways to try to avoid medicine interactions, which includes making sure your doctor, pharmacist, and anyone else who prescribes medicines or health products for you each have a copy of your medicines, allergies, and contacts list with everything you take on it. Colchicine may cause changes in men's sperm while they're taking colchicine, which may reduce fertility. And theoretically, it might potentially cause genetic problems in a child conceived by a man who is taking colchicine, although unfortunately there's a lack of research about this at the moment. So if you're a man who's wanting to conceive a child soon, chat with your doctor about whether colchicine may be suitable for you or not. There's conflicting advice at the moment about whether colchicine might be safe in pregnancy and breastfeeding or not. The Australian Medicines Handbook, or AMH, says that colchicine appears safe to use in pregnancy because there was no increase in health problems in babies in some studies where colchicine was used in women with a medical condition called familial Mediterranean fever. However, the U.S. medication guide for Colcrys brand colchicine advises telling your doctor immediately if you are pregnant or planning to become pregnant because it is not known if Colcrys will harm your unborn baby. When it comes to breastfeeding, the Australian Medicines Handbook says colchicine is considered safe to use, whereas the Australian CMI and US Medication Guide advise discussing with your doctor whether or not to take colchicine while breastfeeding, and if you do take colchicine while breastfeeding, to find out from your doctor how to check your baby for any possible signs of colchicine side effects. Please click the subscribe and like buttons below this video if you'd like to see more of these medicine safety videos. And Denver and I look forward to catching up with you again very soon here on this Pharmacist Fi Medicine Safety YouTube channel. Thanks for watching. Bye.